Welcome to Building the Future, hosted by Kevin Horick. With millions of listeners a month, Building the Future has quickly become one of the fastest rising programs, with a focus on interviewing startups, entrepreneurs, investors, CEOs, and more. The radio and TV show airs in 15 markets across the globe, including Silicon Valley. For full showtimes, past episodes, or to sponsor the show, please visit buildingthefutureshow.com.
Today's show is brought to you by OnPay, the new standard in payroll. You can pay employees and contractors in minutes, automate your payroll taxes and filings, as well as provide health benefits and HR in all 50 states. For more information, visit buildingthefutureshow.com/onpay. Welcome back to the show. Today we have Waqaas Al-Siddiq, the founder and CEO at Biotricity. Waqaas, welcome to the show.
Thank you for having me.
Yeah, I'm excited to have you on the show. I think what you guys are doing at Biotricity is very innovative and cool, but maybe before we get into that, let's get to know you a little bit better and start off with where you grew up.
Yeah, sure. So I like to say I'm Canadian by training and birth. So I say born and raised in Canada, but I grew up in Seattle. So that's kind of this hybrid Canadian-American mix. I'm sure you'll catch it in an accent every now and then.
Sure. No, that's cool, man. So you went to university. What did you take and why?
Yeah, so I from a very early stage, I was very interested in building things. So I became an engineer early on, and my family, my father's background is in business, so I ended up doing a dual major in economics and engineering. Got to university a little bit early, so I started it after 8th grade. So that's I guess a little bit claim to. Yeah, so I had a very interesting experience in university. I would say because of the early start, I never really had a high school experience. So my high school experience was my university experience. And so today I don't have a high school diploma, but I have university degrees. Funny enough. And so I did my undergrads in engineering and economics. I did my graduate work in business and engineering as well. So I got a master's in business and engineering. And then I have a doctorate in business.
Wow. Very, very impressive. That's really cool. So at what age did you actually get your PhD then?
So PhD I got later in life. I mean, I was doing a PhD in engineering.
Okay.
And I ended up just taking a master's and leaving. There was this, this whole interest of, at the time I was doing a lot of work in sensor networks, and I was doing some stuff for the Defense Department, where the idea was to drop sensors out into environments. How do you collect information? So I built security and communication algorithms for it. And so I basically did all the PhD work, and I should have graduated, but my work was very interesting. So a lot of people wanted to keep me around to do a little bit more work. So I said, you know what, I'm gonna take a pause. So I took my master's when I was 18.
Wow.
And went to work, and then I didn't go back for my PhD until I was 25. So it's a little bit later in life.
Yeah, but most people probably don't start their PhD till at least then, if not later. So
yeah.
Very cool. So walk us through your career up until coming up with the idea of Biotricity, and then let's dive into that.
Yeah, for sure. So it's interesting. It actually stems from my graduate work. So when we were doing remote monitoring, I got very interested in this idea of sensor networks and how to collect data. But I was doing it in a very, highly secure, you can't change batteries, complex way, and how do you monitor and basically make complex decision and create decision matrices based on the data that you're collecting. So at that time, I got really interested in, how can you apply that in more of a, consumer or, other markets. So the applications, obviously, in buildings and engineering and in supply chains, and then, of course, healthcare. So got interested in that, but left that and joined AMD, so Advanced Micro Devices, was there on the server side, and sorry, actually, I was at IBM first, and then I went to AMD. It's a long history. So I went to IBM, did the server side CPU stuff, then got poached to AMD, was there at AMD. And then from AMD, I was supposed to go to Intel, and I went there for a short period of time, but then I ended up kind of shifting gears and went to investment banking. And really on the consulting side to basically look and evaluate technologies and products for investment, and did that for a little while with private equity groups, family offices. And when I was looking at some of those companies, I got interested in the cloud computing space. And because I came from the server side, I ended up joining a company on the cloud computing space. That ended up getting acquired. I went through multiple acquisitions. The company ultimately got rolled into NeoWare, that got rolled into Wife, that got rolled into Dell. Left that, and then at that time, I kind of went back into my thought process of going back into the investment banking world, but then realized that, hey, I have some ideas of my own, and I really thought that remote monitoring in healthcare was really the area to pursue. And I had, in my consulting and in my investment banking experience, I had looked at a lot of healthcare technologies, and I had seen some gaps. So that kind of precipitated this intersection from, my background in sensor networks to what I was looking at, what was happening in healthcare. And at that time, if you recall, this was back in 2010 and 12 timeframe, like Fitbit, and I don't know if you remember a company called Jawbone.
Yeah.
All these companies got really, really exciting, and there's this whole concept around gamification of healthcare. And I was looking at all this stuff, and I'm like, I understand the gamification angle, but I really think that the impact is going to be in connected devices and being able to make, real-time decisions. And so I looked at that, saw that there was no platform in the marketplace, and that was the gap, and that's kind of the birth of the company. So it's a bit of a weird story, coming from cloud computing, coming from the server side, very technical, to investment banking, but then really that intersection that connected my investment banking experience of evaluating technologies in many healthcare companies to what I had done in my grad work kind of precipitated this vision.
Interesting. No, I think that's makes a lot of sense. And I think the fact that you come from that background to build a connected device that has kind of real-time reporting is key. Is that correct to say?
Yeah, that is exactly right. So one of the things that we find in the industry, what I have found in the industry, is still true today, is that many people, and in healthcare especially, we talk about monitoring because we think about, you're in the hospital bed,
right,
and you're on these devices and they're monitoring and the nurse can see it. But when you're in an ambulatory room, when you're at home and they give you a device, you're not monitored, you're recorded. The data is recorded. And so decision making is not done in real time because there's no cellular connectivity. You may have a pod at your house, but if you're not in your house and you're grocery shopping, there's no signal because obviously you're not near the pod. And if you're wearing a device, many times you have to mail these devices back. So 2 weeks later, you're getting a report, and you can have major events that happen during that time. So this was the gap that I really saw. I said, there's this need, and because I had come from that sensor network, very engineering, networking background, I was like, this is a place where decision making in real time is actually very critical, and there's an opportunity there.
Okay, very cool. So I want to dive a little bit deeper into how the actual device works. Like, do I have to go see a doctor and then it gets recommended to you? Do you send it right to me? Is it a bit of both? Walk us through that.
Yeah, so it is very much a prescribed product.
Okay.
Today, that is the bulk of our business. Obviously, we have a broader vision as a company. But today, yes, you would go to a cardiologist that uses our product. They would look at you. They would look at your symptoms, look at your family history, and say, hey, we think you have a heart issue, and we need to figure out what's going on. And they will use our product to diagnose. So a doctor is going to, make a surgical procedure on you or give you a medication. Like, it's a very, very high caliber diagnostic tool where there is going to be an intervention that the doctor is going to do based on what our device provides them. So you get this device, you hook it up, and so it's got a built-in cellular technology and everything. So it's a one-piece device, kind of like the size of an Apple mouse, and it connects to your chest. It's got 3 little leads, and you basically go home, hangs around your neck, and you do your thing. And 23 or 23 and a half hours a day, you wear it and you charge it for half an hour. And the device is constantly evaluating your heart rhythm, and anytime it sees anything that goes out of range, it sends an alert. And since it's got a built-in cellular network, there's no delay. It's all real time. Unless you're in a garage or in a bad reception area. But the moment you get back into a good reception area, it'll pump the data. And at that point, we have a third-party call center. They'll review the data and they'll say, oh, there's an emergency going on. And they'll contact the doctor. And so at that time, the doctor can, do whatever they need to do, bring you into the hospital or what have you. And if there's no occurrence of an event, then you just bring the device back. And by that time, the doctor has a report, and then they'll make a clinical decision. And maybe you're going to get a medication because it's not as serious.
Okay, interesting. So walk us through coming up with actually building the device, because you probably iterated a bunch, you had some prototypes out there. Like, how did you go from just an idea to actually getting it into patients' and users' hands?
Yeah, no, for sure. So, kind of a funny story there too. So we had no focus on the end product in the beginning, right? We're like, very engineering, very technical kind of thought process, and saying, hey,
sure,
there's this gap in the market. No medical devices are connected. We're going to create a connectivity platform. So we built that whole platform, built the whole IoT, built the cellular technology, did all that stuff, and basically built. And then we're like, okay, well, that's great, but we've got to apply this platform now into a commercial product. What product are we going to go after? And this is where kind of the business angle of my experience came in, and I reached out and we built a very nice advisory board of healthcare and MDs around the cardiac space, because when we evaluated, we said, well, the biggest market is cardiac. It's the number one killer. Let's look at that market. And what we saw was there's a big need for monitoring and real-time monitoring, because a lot of patients are actually they're asymptomatic. The monitors are not long enough. They go home and then they end up a stroke, or they have a monitor, they're wearing it, and they end up having a stroke, and they're in the hospital and the monitor is getting taken off there. So we said, okay, here's a great need. And then we saw that many medical device companies fail, not because their tech wasn't good, not because they didn't get FDA, but because they didn't have a reimbursement model. So, healthcare is more convoluted and complicated than traditional technology. You can start up a traditional technology company, do really well. If you can find a customer, you can grow the business. Well, in healthcare, you have to build the technology, then you got to get FDA clearance, then you got to do your reimbursement, because if you don't have reimbursement, you don't have a business model. So we figured out the reimbursement angle first.
Interesting.
And aligned our FDA clearance and all that. So we said, okay, we're going after cardiac. This is a need. Figured out the reimbursement, then built the product. So we applied our platform technology into that product, worked with a number of cardiologists, and brought in MDs into the company as well as onto our advisory board to really build out the right solution. Got the FDA clearance in end of 2017. Spent about 9 months, 10 months just really working out you never really know until you launch a product, but also the insurance. There's a lot of angles in insurance. U.S. healthcare is quite complicated from a reimbursement standpoint. So we spent about 9 to 10 months doing that, and then basically really commercialized the product in the beginning of 2019. And we've been growing 300% since. Now we've got our product in 19 different states, 500 different cardiologists across 200 centers.
Wow, that's really awesome. Congrats on that success.
Thank you.
So how did you guys fund this? Did you self-fund? Did you raise some money, a bit of both? Walk us through that, because I think most people at this point know building software is expensive, but building hardware and software is even more expensive.
Yes, and building healthcare hardware and software is even more expensive.
Yeah, true.
Yeah, so part of it was, originally the original concept and stuff like that was very much self-funded,
Okay.
a little bit, and then obviously we did our traditional angel round, friends and family, and then we went into the private equity space. Because my investment banking experience was private equity, I went
Right.
back into my private equity network. So we're kind of this, I would say off of the traditional sandhill. I don't know how familiar you are with the Silicon Valley Sandhill Venture
Yeah.
a group, but there's a very specific way of funding and investing in companies that way. And then you have the East Coast model, which is very private equity based.
Okay.
We adopted the New York model, private equity model, where you've got family offices and high net worth individuals that are funding the company. And we went through a series of capital raises, and we are now planning on doing another growth capital round. But that was kind of our journey, as opposed to, the traditional VC journey, which is, your angel investment, and then you find a couple of VC firms that then fund multiple rounds. We did private equity capital, and we were very capital efficient. So we've taken in about $35 million to date in hard capital. And we have a product in the market, generating revenue, growing at 300% a year. In healthcare, you will spend $70 to $100 million before your product is even in the market. So we've been very capital efficient.
Interesting. And why, like you kind of mentioned it, but I think it's worth kind of diving a little bit deeper into that. Is it because you figured out insurance and that model first, or what really made you that capital effective? Because you're talking about a lot of money you're saving.
Yeah. So I think it's a combination of two things. One is really this idea of analyzing and understanding that medical device companies fail because they don't have reimbursement. So figuring out the reimbursement angle first, that was certainly one thing. And I think the other thing which actually benefited us is, if you look at our company, we've got some very talented people that are not from healthcare. It's actually, I think, one of our advantages. All tech people, all highly scalable, put out multiple products into the market in many countries in the world, but they are not healthcare people. Then we've got healthcare advisors and healthcare specific people to really, obviously manage our product and build in the right requirements to make sure it's effective for the market and has the right features and whatnot. But what happened is that traditional tech people who want to scale companies, they want to go fast. So what happened is we have this methodology in the company where we want to do everything in parallel. So for example, we went to the FDA, as even happened with our existing product, and they're like, your lab testing, so you have to go through lab testing for the FDA. And they're like, well, it's going to take 8 months. And we're like, what do you mean 8 months? And they're like, well, you have these series of labs, and you have to go through all of these labs, and they take, one by one, they take 8 months. And we're like, okay, we'll say, we looked at the lab tests and we're like, well, we can parallel some of these lab tests. Like, they're not required to be sequential. We can do this in parallel. We went back to them and said, well, what would happen if we cut up the tests and we gave you like 10 devices and you do all of these tests and you do some of the ones are parallel? And they're like, well, no one's really done that. Why would you want to do that? And we're like, well, time to market. That's why we want to do that. And so, they were very confused, but we worked with them and we ended up shrinking that time to 4 months.
Wow.
Because people in healthcare are traditionally saying, okay, you have to do things sequentially. And we're like, no. We got to do things in parallel. Whatever is sequential is sequential. But if we can break things up and we don't have to be dependent on it. So we were dealing with like 3 or 4 different labs at the same time with multiple devices to shrink our timeline. Whereas other people would be like, okay, let's just deal with one lab. We sit for 8-9 months. We're very well funded. We just bring more capital if we need to. We approach things not only from a capital efficiency perspective, but just because we wanted to get to market. And so I think that idea of parallelism and understanding reimbursement beforehand is what allowed us to be so capital efficient.
No, makes a lot of sense. And it's nice to like still play by the rules because like obviously you have to in healthcare, but it's also nice to
Yes,
figure out the
correct.
ways that you could kind of shortcut the timeline to get things done, because just because something was done a certain way traditionally doesn't mean it's the best way, right? And I love when people like yourself kind of figure something else out and just say like, no, well, we can cut this way in half, right? And you're right. And in a lot of cases, you need somebody outside that specific industry to come in and recognize something. And then when you guys finally figure that out, you're like, well, that's so simple. We should have thought of that at the beginning, right? But until you actually think about it, it's actually really challenging.
Yes, no, exactly. And you really have to kind of think about, and like you said, you still have compliance, right? You have to comply and follow the process. But you can comply with the process, but you're innovating the process. And that is an innovation in and of itself. But, like you said, many times you have to come from outside of that world to have that out of the box thinking. And what's happened now is a lot of the engineers that work with us that are from the healthcare and stuff like that, they really have adopted that mindset and adopted that culture in the company, and they actually really enjoy it because, our urgency is very different. And in healthcare, generally everything's like, okay, well, it's a process. We're engaged on it. It'll get done.
Fair. Yes. Okay. No, that makes sense. So I want to dive a little bit deeper into your hardware and software solution. And I want to talk about how it competes with, because everybody, well, the craze of like the Fitbit or the Apple Watch or the smartwatch claim to do some of this stuff. There is a big healthcare disclaimer saying that, you still can't really use that stuff as like a healthcare device. But how are you similar and different from an Apple Watch or a Fitbit or any of the other smart connected devices that people could be like, well, my watch does what you guys do?
Yeah, no, for sure. So I'll kind of break this up into a couple ways to try and simplify, because there's components of it, right? So
Right.
Let's take the Apple Watch or the Samsung Watch as an example, because they have an FDA clearance and they have ECG. Okay.
Okay.
So one component is ECG, and then one component is heart rate. So their heart rate on the watches is continuous. You wear the watch; it's continuously collecting the data, but it's not collecting an ECG. If you've ever seen one of those watches, you turn them over, you see these little LEDs.
Yeah.
They're basically injecting light into your skin and looking at how light bounces back to determine if your blood is oxygenated or not oxygenated. And that allows them to determine the pump, right?
Okay.
So that gives you heart rate. So it's the same as putting your fingers on your pulse and counting. That cannot diagnose electrical activity in your heart. So an ECG is about the electrical activity of your heart. So the heart can have two issues, right? It can have a plumbing issue or it can have an electrical issue. So that light is looking at plumbing. It's basically looking at heart rate. It's not even looking at plumbing. I shouldn't say it that way, but it's basically looking at your pulse.
Okay.
And that's continuous, and it has no value in the diagnostic electrical world. So that's the continuous piece that these devices have. It's very good for if you do have heart rate problems and your heart rate goes up and down. People have techies and Brady's all the time. It's a nice little device to have for awareness for diagnosed patients. So you're already diagnosed and you have it. If you're not diagnosed, it's great for awareness. And you're like, oh, my heart rate goes up a lot. Maybe I should go see a doctor. And then you can get a referral. But you will then be put on a diagnostic device to look at, well, what's going on? Is it an electrical issue or is it a plumbing issue? And so that's where those devices I find is complementary because they bring awareness. So that's the whole light issue. Now let's shift to the ECG, because these devices do have ECG, and that's important. So ECG is looking at the electrical activity of your heart. And to collect your electrical activity of your heart, you actually have to go across your heart. So in order to collect an ECG on an Apple Watch, you actually have to, or a Samsung Watch or any of these watches, you have to complete the circuit, if you will. And what that means is you take the opposite hand from the hand that you're wearing the device and you touch that device. And while you hold it, you get a spot ECG. and it's a one-channel ECG, meaning one view of your heart. And that's enough, and the quality is enough to actually get a diagnosis. The problem is, 90% of patients are asymptomatic, and you need continuous ECG. So I'll give you an example. So our device, patient is complaining of something. They go to the doctor. The doctor prescribes our device. They wear it. Now they're wearing this 23 and a half hours a day, every single day, and it's collecting 3 angles. So we have a 3-channel device. And after 4 days, it'll catch something. Let's say it's an emergency, or let's say it catches something. And the study ends, and the patient goes back, and the doctor gives them a medication. But in order to do that on a watch, you'd have to hold that watch for 4 days, or 23 hours, charge it. So no one's going to hold the watch with both hands for that long period of time. So continuous monitoring of an EKG is what's required. And what these devices give is they give continuous monitoring of pulse rate and spot checks of ECGs. But spot checks of ECGs, it's 1 in maybe 10 million chance of catching something, because you have to, if 90% of patients are asymptomatic, they have to basically happen to have collected an ECG at the same time as they were having a symptom, which they were unaware of. But I go back to these watches, and these devices are great for people who are unsure if they have an issue, or they do feel something, but they don't think it's a big deal. And then suddenly the device says, hey, maybe you should go in and check with your doctor. But when you look at the reports and the analysis, they're saying, its effectiveness is very, very low in terms of identifying patients. But it certainly is an awareness builder. But in another way, kind of a tongue-in-cheek comment, a cardiologist is not going to crack your chest open and install something based on what these devices say, right? They will based on what our product says.
Got you. Okay. No, that makes sense. And it's good to clarify. And to be honest, I was kind of selfishly fascinated about how that all works, right? Because, and I guess until you just kind of explained it, I never really knew what that really meant, right? When Apple basically openly says, or all of them say that this is, if you see an issue, you need to go see your doctor, right? And you're right. They're not going to just cut you open and put something in you if, because any smartwatch told them to. They're going to investigate further. No, that makes sense. So I want to get back to somebody actually wearing the device. So you can use me as an example. So if I'm wearing this device for 23 and a half hours a day, and then I charge it for a half hour, walk me through, do I have to do anything special? Can it get wet? And then do I have access to the portal, my own data, through an app, or walk us through the day-to-day of actually having one of these devices?
Yes, for sure. So the device is water resistant, but the idea, what we say is when you're showering or something like that, just charge the device. It's
Gotcha.
The best time to essentially charge it. But you essentially live with the device and again, remember, these are high-risk patients or somebody who's very concerned about their heart condition, right? So
right.
you want the best device possible. And so we are the only device in the market that has 3 channels with 3 leads, which is basically 3 little wires. So you have 3 channels, so 3 views of the heart. Typically, to get 3 channels, you need 5 wires. So we've engineered that in software and hardware. So patient gets the device. They live with this device. They're wearing it. They don't actually have to do anything. They don't get access to their data unless they request it from their doctor, because we don't want to scare patients.
Sure.
But what it does is it's actively monitoring you. So while it's collecting your ECG, because it's recording the entire time you're wearing it. And so we know everything that happens. We know when you charge it. We know if you turn the device off. We know if you disconnect it. We know how long you've disconnected it for. So it's smart. It's very much a smart, intelligent device, and it's got built-in cellular technology. So it takes its own SIM card and has its own FCC ID. So we have our own FCC ID, like a regular cell phone manufacturer for a small company.
Interesting.
So that device is worn, and then when it detects an emergency or an issue, it, like I mentioned earlier, it alerts a call center where you have certified technicians to review this data, because they will determine, hey, could it have been a false positive? Could it have been some other reason? Or is it really an emergency? Because we will make alerts that maybe the settings on the device were incorrectly programmed, or it was a spike, but then it went back to normal. So it was an event, but it wasn't like life-threatening. So it'll just get included into the report. There's no point in bothering the doctor about it. And so that's what's happening, right? So the device is constantly and actively monitoring you. And anytime it sees an issue, it alerts, and then you end up getting a final summary that the doctor will then, you go back in, return the device, and he'll speak with the patient and give them the conclusion of the report. And what happens is, we will find patients that 2 o'clock in the morning, 3 o'clock in the morning, they're effectively sleeping, but their heart stops for like 5-6 seconds. We get them into the hospital and they get a pacemaker installed. If they weren't on our device, they would not wake up.
Gotcha.
So, these are very, very real life scenarios. We had another patient come, this happened I think it was like a couple of days ago, completely asymptomatic, went to a cardiologist's office, and the doctor put him on the device. He walks out of the office and I think got into his car and was just driving out, and a phone call went to the doctor saying this patient is in AFib. If that patient, within an hour, they would have had a stroke.
Wow.
Because they were asymptomatic. Like the doctor thought that the patient had AFib, but he's using a device to diagnose it. So he hooked up the patient. The patient was already in AFib, but the patient wasn't feeling it. And the device caught it almost instantaneously. And then he was admitted to the hospital within, 20 minutes of getting hooked up to the device. So,
wow.
Those are like interesting scenarios. And then of course we have like, the regular scenario where you have the device is worn, you get the event, there's nothing really life-threatening, you get a summary, the doctor either does a surgical procedure or puts them on a medication. And, they're still high-risk patients, but, it would be, we catch these things early. So it's, 6 months, 9 months before, some life-threatening event happens. They got the device early enough.
Yeah, no, that's really cool. And it makes a ton of sense, right? Like the fact that you can get real data about somebody and it's not delayed by days or weeks or months. And especially with the pandemic right now, I think a lot of people, especially people with a serious health condition, some probably want to go to the doctor, but other people it's probably they don't want to go at all, but they know they might have to go. But if they have a device like yours that's constantly monitoring them, and if they need to go to the doctor, then you can tell them, okay, you need to come in, right, for whatever to get looked at.
Exactly. And the traditional technology in the space, is the Halter Monitor, right? And the Halter Monitor, and now, companies have created a patch monitor. But again, I'd say the term is incorrect because it's a recorder. You put somebody on a Halter patch, right? And it records the data for like 10 days or 14 days. You peel it off, you stick it in an envelope, and you mail it back.
Oh,
and
okay.
so a week later, you get a report. So like if you take that patient with 20 minutes, patient would have had a stroke. Maybe they would have survived. Maybe they wouldn't have survived. But they would have had a debilitating problem, and that would affect them for years. So because the device has no communication, has no connectivity. And then I would kind of extend and to one of the questions that you asked earlier, which was do patients get access to this data? And obviously in the diagnostic space, we say no because FDA says you can scare patients, and there's a lot of studies saying that patients can become more symptomatic if they're aware of, and you can scare them unnecessarily. But we see a need for that particular component, and that's where our vision as a company is to take our technology and really build it into a consumer-oriented product. Just as a diabetic has a glucometer that allows them to manage their life and their diabetes, we are very much focused on building a product for cardiac patients because they have nothing, and that's the number one killer, where they have a product that's available to them, where they do get data, and it does tell them, and it does give them feedback, like a traditional glucometer device would, and lets them manage their life, but more on the consumer lifestyle space as opposed to the clinical diagnostic space.
Got you. Okay. So when roughly are you going to potentially have that device ready for consumers, or you don't know yet?
So we have prototypes already.
Okay.
Actually, I should say we have more than prototypes. I use the product. So
Okay.
not that I have a heart condition.
Yeah.
I'm an engineer at the end of the day, and I like my toys. So,
Sure.
but the plan is to really launch that product in summertime next year. So
Okay.
that's our plan. Product is built. We're obviously generating feedback. We're collecting some data, and getting the right sort of packaging and all of that together. But the product is completed from a hardware and a software perspective. Now it's about the experience for the user and how do we build an environment that is very helpful and meaningful for someone to live their life.
Got you. No, that makes sense. So I'm curious then, if you're using it, and I know like there's a lot of people, and I put myself in this category, I love my tech gadgets for a number of things. Like, is it useful for somebody like myself? I'm 37, just for some context, and healthy, like as far as it was my last checkup, right? Like, would I get any benefit from using it, or is it just more of like a nice to know and start collecting this data, or how does that play into all this?
No, it's a great question. I mean, primarily the product is really meant for people that are diagnosed with cardiac conditions to manage their life. That's what it's meant for. But there are a lot of people, there's a whole quantified self movement, people who are very, into sports, right? They want to look at, how do I optimize my workout, right? So in this case, it's the perfect kind of product, right? So it's like, hey, they have that whole focus on interval training. Sorry, I was thinking of the word interval training, where you get your heart rate high, and then you bring your heart rate low, and you bring your heart rate high, and you bring it low. And so this would be a great product where your accuracy is so high, because we're really focused on accuracy, and we're a medical device company. It's a consumer product that we're building, so it's not going to be go through the FDA cycle like the other product. But at the end of the day, we focus on accuracy. So that type of information allows you to really, if you're into maximizing your workouts, or if you're an elite athlete and you're really focused on performance, it's certainly a product that could help.
Interesting. So this is maybe a dumb question, but the consumer version of this product that you just mentioned, do I have to get cut open to hook it up, or how does that work?
No.
Yeah, okay. That's what I figured, but I wanted some clarifying.
Dry lead. No. It's a good point. It's a non-invasive dry lead, little device, almost a little bit bigger than a silver dollar in terms of size. I'd say about it's 1.5 inches wide, about quarter of an inch thick. It's got a strap that you wear in a very specific space, like right underneath the sternum. It's got a dry lead polymer electrode, and you basically wear it, and it'll collect your data. Think of Iron Man, okay? We'll make everybody Iron Man.
That's cool.
It's a little device that kind of sits right there, and you wear it, and you go about your business, and it collects the information, and you wear it as you want or as you need it.
Got you. Okay, I just wanted to clarify that, right? Because I think that makes sense.
Definitely not. No cutting open for a consumer product.
Yeah, that's fair enough. But some people might do that too. Good. But yes, that's fair enough.
Yeah.
No, that's very cool. But we're kind of coming to the end of the show. So how about we close with mentioning where people can get more information about all the stuff we talked about today, and where they can maybe get more information about when the consumer device and everything else that's going to be available?
Yeah, absolutely. So, you can visit our website, biotricity.com. We have all of our product and information there. We're going to be doing a limited, kind of market interest release type information on the consumer product. It's going to be called BioHeart. That'll be available on our website once we announce it. So, if you go onto our website and input your information, so you become part of our newsletter. We're always engaging with potential clients and people, and we also have our Instagram and Facebook and all that as well. So many points of contact to the company, and that's where we will be announcing. So as soon as that's available, you'll be able to see it on the website. And right now on the website, you'll see our existing products and our vision for the company and where we plan to go.
Very cool. Well, I really appreciate you taking the time out of your day to be on the show, and I look forward to keeping in touch with you, and have a good rest of your day.
Well, thank you for your time, and loved chatting about this stuff. Obviously, it's a passion of mine. So I hope I was able to answer your questions, and happy to come back anytime you need us.
Perfect. Thanks very much. We'll talk soon. Okay, bye.
Bye.
Thanks for listening. Please visit our website at buildingthefutureshow.com to join the free community, sign up for our newsletter, or to sponsor the show. The music is done by Electric Mantra. You can check him out at electricmantra.com and keep building the future.